Hello viewers, my name is Adini Adeyanjo, a psychologist from Piedmont Hospital in Atlanta. What we'll be discussing about today is OCD. What do we call OCD? OCD is obsessive compulsive disorder. I'll be making an emphasis on one of my clients who is Sean Phillips, who has OCD, and the treatment we used, how he's been treated, got healed. OCD is a serious anxiety-related conditions that affects 1.2% of the people in the United States, and is a part of daily life for over 1 million people every single day. OCD is a disorder where a person experiences frequent and unwelcome obsessional thoughts, often followed by a repetitive compulsion. According to the DSM-5 guidelines, obsessional symptoms or compulsive acts of both must be present, which my client, Sean Phillips, has. He has both obsessional, which are unwanted thoughts that causes distress, and also compulsion, that is repetitive behavior performed in response to uncontrollable urges, which he has the symptoms for almost 2 years and has been treated. Yeah, like I said, my client has these symptoms for 2 years. He had both obsession and compulsions. He had intense stress when objects aren't orderly or facing a certain way, which leads him to following a strict routine and spending hours arranging and rearranging his house. Researchers have also classified 4 major types why we have OCDs. 1. Contamination and washing. 2. Doubt about accident, harm, and checking. 3. Symmetry, arranging, counting, and just right OCD. And lastly is unacceptable taboo and thoughts and mental rituals. Yeah, there are 2 different types of treatment or therapies for treating OCDs, namely psychotherapy method and biomedical method. Yeah, in psychotherapy method, which we call cognitive behavioral therapy, is effective for many people with OCDs. Secondly, exposure and response prevention, which we call ERP, involves gradually expressing or exposing the patient to a feared object or obsession, and having the patient learn healthy ways to cope with anxiety. Yeah, the psychotherapy is about medical therapy, which we also called medication. And there are types of medications which are more effective in treating OCDs. The specific drugs that my client, Mr. Sean, used in treating OCD is anephrolane. It has been around for a very long time, and it's been studied by OCD medication. It is very important to note that all medications work well for everyone. My client, Mr. Sean, used both therapies and currently cured of the disorder and is now okay and living his fullest of his life.